Now that you're 36 weeks and 2 days, at today's visit, like we talked about briefly in the last visit, we are going to be doing your group beta strep testing. Group beta strep, as we talked about before, is a bacteria that's found at the end of the digestive tract. In women, it can be found also in the vagina and the rectum, and is not harmful to us. It's not a bacteria that's harmful to us. Most of the time, we're asymptomatic, don't even know that we have it. But if it comes in contact with a baby, can cause a ton of complications. So let's talk about factors for that. So approximately 40% of all pregnancies are affected by group beta strep. It is a transient bacteria, meaning that it could be present in the vagina today and not present in the vagina tomorrow. That's why we try to test it as close to delivery as possible. It has a shelf life of about 4 to 5 weeks. So we, don't want to test it too early and say you get a negative and then develop it several weeks later. And we could have superseded that infection. So what does group beta strep testing look like? Basically, it's just a regular swab, something like this one right here. And what we'll do is we take this swab, and I'm not going to let you use this one. I'll let you use a sterile one, of course. But you're going to take this swab and you're going to go into the vagina, swirl around for a little bit, just enough to make sure you get a lot of cells and stuff on there and things on there. And then you'll come out of the vagina and then in and out the anus. You're just passing it in and out of the anus, and then it goes right back down in the tube like so. And we'll send this off to the lab for a culture to see if anything develops. So what does it mean if you come back positive? A positive result does not mean that you risk out of home birth or anything like that. There are different options for treatment. The gold standard for treatment, if you were in a hospital setting, or a lot of midwives actually treat this way as well, is with prophylactic antibiotics. So you would receive at least 2 rounds of antibiotics prior to delivery after the onset of labor. So once labor starts, we would get an IV started, get some IV antibiotics pumping, and hopefully get 2 rounds in before baby comes. The other option is for you to do a water birth. Studies have shown that giving birth in the water kind of dilutes the GBS, the presence of GBS infection, and can be beneficial for you and baby during birth. The other option is for you to treat holistically with probiotics. We can double your probiotics from now until delivery, the dose that you're taking, or you can, and additionally, you can do vaginal probiotics. There's not a ton of research on the efficacy of that, the effectiveness to see if it's better than what the standard is doing vaginal probiotics versus antibiotics versus a water birth. But I do know that the way that probiotics work is they help to kind of fluorinate the vagina, and they also kill any bad bacteria that's present. So that's kind of the science behind that. So what does a GBS infection mean and look like for a baby? Babies, typically GBS infection presents itself within the first 24 hours of life. You might notice that your baby is lethargic, kind of hard to wake up. You're having issues with latch and with feeding. They're having rapid respirations above 60 a minute. And that proceeds longer than the normal newborn transition period of the first 6 hours. They may also have a fever. So it can, and those symptoms can worsen. And they will, if those symptoms do present, then unfortunately we would have to transfer baby to the hospital for IV antibiotic therapy. So again, there's some risk involved with each of those options that I gave you, and I'll have a printout for you, and you can go over it with your partner. You can talk about what the options look like. The biggest thing with the option for taking antibiotics is you have to remember, as we've talked throughout this entire pregnancy, the importance of building a great microbiome and immune system, and having great flora in the gut and the vagina for you and baby. Gut flora, that we know that all 80% of all immune responses happen in the gut. And with you taking care of your gut flora with probiotics throughout the whole pregnancy, antibiotics will wipe all of that away, because antibiotics just kills everything. It doesn't discriminate. It kills the good bacteria and the bad bacteria. Versus doing a vaginal probiotic where we know the bad bacteria will be destroyed, and any type of viral or infections that are trying to grow in the vaginal flora, as well as seeding of good lactobacilli that is so needed for the balance of the pH of the vagina. So I hope I answered any questions that you may have about GBS, but feel free to hit me up with anything else that you might inquire about, or anything you encounter on the sheet when you and your partner are reviewing your options. And just let me know what you choose.